Natalie Rodriguez is a 28-year-old grade school teacher who used to live a sedentary lifestyle. Although lightly active, Natalie wishes to become more knowledgeable on resistance training so she can lose 15 to 20 pounds. She is a former smoker and had an MCL tear in 2014. For fitness professionals, functional assessments are a great tool that can be utilized to address a client's flexibility, range of motion, and overall functional capability. This is done so that a proper program can be applied. There are many functional assessments that are used, from a static postural to a transitional movement to dynamic and so on. Static postural assessments are typically used at the beginning of the test. Dysfunction imbalances that are visible while the client is in a stationary position may be more aggravated or caused more injury in functional movement. The following are key checkpoint areas that are observed during a static assessment: the foot and ankle complex, the hips, pelvis, shoulder, neck, and head. For Natalie was noted to have overactive and shortened muscles for both upper cross and pronation distortion. Because of this, she would need to conduct self-myofascial release and foam roll prior to exercise. Strengthening exercises for upper cross syndrome include everything from chin tucks, floor cobras, to TheraBand rows. Integrated exercise can be a combination of ball movements. Some strengthening exercises for pronation distortion syndrome: isolated strengthening of the anterior tibialis via resisted dorsiflexion, posterior tibialis via calf raises, gluteus medius via wall slides, and gluteus maximus via floor bridges. Integrated exercises in multiplane single leg balance reach to maintain neutral foot and knee alignment. Additional ones would be medial hamstring cable curls, ball bridges, and lateral tube walking. Movement is what drives the human body throughout the day. The ability to move in a functional and operational manner are imperative in order to complete or conduct daily activities. Natalie is conducting both an overhead squat and a single leg squat. As you can see, she has excessive forward lean, her arms fall forward, and she has knees that move inward. Some strengthening exercises for excessive forward lean would be hip extension, ball wall squats with a press, single arm resistance band flexion, and a squat with a resistance band. Some strengthening exercises for arms falling forward would be a squat to row, as well as external rotator activation. Strengthening exercises for the knees moving inward would include glute, VMO, and tibialis activation, along with sideline clams, sideline hip abduction, glute bridges, band walks, and body weight squats. The Davies test. The Davies test is designed to measure upper extremity agility and stabilization. Given that Natalie's lower back arches and her hips do not remain neutral, some recommendations for corrective exercise would be conducting fire hydrants, leg curls, lateral band walks, and lying leg lifts. For Natalie's 8-week program, a focus for the first 4 weeks will be on flexibility, range of motion, ankle mobility, and conducting all specified corrective exercise techniques. This will be done for pronation distortion, upper cross syndrome, knees caving inward, and arms falling forward. All corrective movements, both for strengthening and SMR, will be followed and guided by the NASM corrective exercise continuum. For weeks 5 to 8, Natalie will focus on continuing to do progressive corrective movements. However, it will be broken down into upper and lower body segments, with resistance training occurring for the opposite. For example, if Natalie could conduct a corrective exercise for lower extremities, then she will have a focus on upper body resistance training. Cardio endurance, along with core strengthening, will be implemented, as well as an active day of rest and a day of flexibility. Natalie is prepared and super excited for her progress. Her goals to lose 15 to 20 pounds do not have a time frame. However, she's shooting to try and lose between 2 to 4 pounds a month in a healthy way. Natalie is looking forward to making her new active lifestyle sustainable and something that she can thoroughly enjoy.